I'm Ernest Lamoth. I'm a reporter for the Southland Journal.
Hi, and I'm Ollie Idowu, President and CEO of the Illinois Primary Healthcare Association.
Okay, Ollie, thank you very much for joining us today. Can you talk to us a little bit about, for people who may not know, some of the work that you do and some of the work overall that's done at the Illinois Primary Healthcare Association?
Sure, thank you. So the Illinois Primary Healthcare Association is a trade association that represents 53 community health centers, or what we call federally qualified health centers across the state of Illinois. We have a network of over 400 sites that provide high quality, cost-effective healthcare to those who need it. These health centers have been around for a long time. There's several of them on the South Side, still going strong, and been very, very active, particularly during this pandemic times.
And can you talk a little bit about some of the initiatives that you're passionate about, the organization is passionate about, that they're looking to spearhead this year?
Sure. So, as obviously, we're always looking for ways to just kind of continue to do more in the communities we serve and to support our members in the communities they serve. But this year, I want to highlight two things that I think we as an association or membership is really pushing. One of them is on what we call the Equity and Representation in Healthcare Act, which focuses on strengthening our workforce, making sure it's diverse and making sure, especially during this time, that we have a workforce that can meet tomorrow's healthcare challenges. The other one I want to talk about that we're working on is making sure that we prioritize protections for the 340B drug prescription programs, the discount program that's offered here in the state. So those are the two main things I would say that we've been working on that are priorities for us this coming legislative session.
And you mentioned the pandemic earlier. Can you talk a little bit? There's not an industry that hasn't been rocked by the pandemic, but especially obviously healthcare. How has it been the last couple of years?
Well, as with other industries, I think particularly in healthcare, the biggest thing is how we respond, right? How we respond and what the impact of that response has been, right? We've gone from testing to vaccination to all those things. But one of the good things that we've done along this time, because people can't come in, limited travel, people were quarantined, all those things, was the expansion of telehealth in Illinois. And that was a big deal. So if you ask me what's changed in this pandemic time and how people consume health or what's going on, it really is our health centers, and I'd say a lot of healthcare providers' ability to adapt in how we provide care and what that care looks like. And also, again, paying homage to our frontline healthcare workers and the work they've had to do in making us whole, in standing us and looking after the rest of us during these times, putting themselves at risk. I mean, that's really been the bulk of what I say has changed in healthcare, or at least for our industry in this pandemic times.
And recently, Illinois Governor J.B. Pritzker gave his State of the State and talked about a lot of various things, but obviously talked about healthcare as well too. What were some of the key takeaways that you got from his speech, and what were some of the things that you liked the fact that when he focused on healthcare, that you thought he was on the right page with you?
Yeah, so I always give kudos to Governor Pritzker and to the administration, and I think what we take back, we just really liked that in fact they had a multi-pronged approach to restoring growth in Illinois' healthcare workforce, which I talked about at the onset as one of our priorities. And every basically spectrum of healthcare right now is experiencing these workforce shortages. Also, just the emphasis on continuing to make sure we strive for diversity, equity, and inclusion, particularly through workforce and other means. I think we found really, really encouraging in his budget address. And other things you can talk about, just making sure that we restore Illinois to a better fiscal state in terms of how we handle our finances. We found all those things to be encouraging, for sure.
And this is an obvious question, but I just kind of got to get your thoughts on it. You mentioned equity and inclusion. Why are those two things very important?
Oh, well, we might we might have to spend a whole day talking about that. you know, but I'll say this. Look, when we talk about equity, diversity, and inclusion, the thing we say and things our members will say is it has to be intentional, right? It has to be intentional. It's not just talking the talk. We have to walk the walk. And I think when people talk about it, we don't always look at the value in equity itself. The value in equity is in investing in the people, investing in communities. And that's one of the things I would give, homage to the governor in talking about, because he talked about investing in Illinois, investing in the people of Illinois. And that's what our community centers seek to do, right? It's investing in the communities, providing the best care they can. So for me, when you talk about equity and all the conversations we can have, it really starts with us honestly having those conversations and having the intentions, the honest intentions to invest in people, to do the right things. That's how that conversation begins. Everything else we get from there, it's gravy to me. But really, equity is about investing in the right things and investing in those communities. That's how we start to approach that subject. And we can talk about it all day. I'm sure you're passionate about it as well. But that's sort of kind of the skinny on it for us.
And why are community health organizations just so essential right now?
Yeah, I mean, look, I struggle with this a little bit, and I'll be honest. Let me explain why. Because the pandemic kind of put a spotlight on what health centers have always done. I mean, health centers have been around for a long time, providing quality care at a very cost-effective rate for a long time. I mean, we take all comers, regardless of the ability to pay. We've been doing that for a long time. And then the pandemic hit. And then people started thinking, well, how do we roll out testing? How do we do vaccinations? And there we are, right alongside them in the communities. And oh, by the way, that's not the only thing we do, right? People think about primary health. They forget about all the social determinants that affect a person's health, right? Health centers have been doing all those things for a very long time. So to me, I'm always going to sing the praises of health centers. I'm always, my mom gets her care from a health center, right? I just think that when you talk about true community health, population health management, all those conversations start at the very heart of it at the health center. And I'm always proud of the work that our health centers do. And always continue to advocate for them to continue doing what they're doing.
Ollie, is there anything else you'd like to add that maybe I didn't ask?
Right at the top of my head, none that I can think of, but I want to just say to you, thank you for the opportunity to talk about the work we do. And again, always looking forward to opportunities to highlight the work that health centers do. Again, we've got over 53 of them across the state of Illinois, just with tremendous reach. Any given year, almost 1.5 million people that they serve in the state of Illinois. So, people don't think about us when there isn't a pandemic or those kind of things. But again, the work that they do cannot be left unspoken. So I just want to close with that piece here. Always looking to take questions to people that want to learn more about health centers.
Well, I thank you once again for joining us today.
Thank you. It's nice meeting you.